Hi, my name is Yonah Krakowsky. I'm a urologist. It's a pleasure to talk to you about UTIs today. UTI is an acronym for Urinary Tract Infection. Urinary tract infections are incredibly common and cause a lot of morbidity. The symptoms of a urinary tract infection, which is basically bacteria that is growing inside the bladder, are dysuria, pain with urination, urinary frequency, peeing more than often, urinary urgency, a very strong sense to urinate, and even blood in the urine called hematuria. The problem is these symptoms are not unique to urinary tract infections and can be caused by other causes or etiologies. In order to diagnose a urinary tract infection, two things are typically needed: a history and physical examination, and also urine tests, showing in fact that there are bacteria in the urine. There are two typical tests we order. One is a urinalysis that looks for the presence of white blood cells, a marker of infection, or other markers of infection, including red blood cells. In addition to that, we typically like getting a urine culture where the urine is actually put on a dish and we wait for bacteria to grow so we know the types of bacteria that are in the urine, as well as getting a sense of what antibiotics, what medications would be helpful in eradicating the bacteria. Typically, if left untreated, a urinary tract infection will cause symptoms. But due to the flow of urine, many people will pass their infections on their own. The reason we treat urinary tract infection is to minimize the severity of symptoms, the duration of symptoms, and long-term complications, like infections that can ascend up the urinary tract and affect the kidneys, called pyelonephritis. Pyelonephritis is a serious infection that can cause severe illness in patients, requiring admission to the hospital and sometimes even the intensive care unit. Thank you very much.